Thank you so much for being with us this evening. If you are not a member of Women's Voices, we welcome you to join us. You can do that by getting a membership packet in the back before you leave, or you can go online and there is a very easy button to click on our homepage where you can join us. And we also welcome you to donate to Women's Voices. You can do that online through that same button. You can also do that through an envelope that we have at the back, and it helps support the work we do throughout the year, including producing these monthly programs that we have. This is our last Thursday program of our program year. We do programs from September through May. And so this is our last one, and we don't have anything coming up soon, but we welcome, if you are interested in participating in the planning committee for the programming, we will be meeting on Monday at 1 p.m. at the church. You can contact us for more at Holy Communion Church, which is where our offices are. You can contact us for more information. We welcome you to come. This is when we gather and talk about the programs and ideas that we have for next year, because we do those all over the summer so that we can get the information out before the program year starts. And finally, we are starting some member engagement programming. And if you would like to be a part of the member engagement team, Michelle Steinberg is at the back table, and she'd be happy to talk with you. We are going to do some welcome neighbor dinners. And if you're not aware of the program, it is a group of immigrant families who come together to make a dinner and provide it to groups who meet somewhere in homes, in churches, in community centers to have authentic food from their country. So we are going to start with a welcome neighbor meal this summer. So we're working on the details for that, and we're welcoming, coming in. We're trying to get back into person. So we're going to start doing that with a meal this summer, and then have some more ideas for member engagement. When we did our strategic planning polls, that was one thing that people really asked for. I would like to turn it over to Lynn Lupo, who will introduce our guests.
Thank you. Thank you very much. Good evening. I'm Lynn Lupo, and I want to welcome you to the Women's Voices Raised for Social Justice monthly evening program. This month, we will introduce you to Operation Food Search. OFS aims to ensure Missouri's and Illinois' children, individuals, and families have the food they need to live healthy lives. The current state of food insecurity limits access to sufficient quality food for many of our neighbors to meet their basic needs. Operation Food Search strives to educate others about food insecurity and advocate for policy changes on the state and federal levels. I'd like to introduce you to Jocelyn Fudukos. Am I saying that correctly? Okay. She is Director of Communications, and Jocelyn oversees communications and marketing to both provide immediate hunger relief and to develop long-term solutions to food insecurity. She supports the advocacy efforts and innovation programs at OFS by helping change the conversation around food security and champion change on federal, state, and local levels. Also speaking tonight is Beverly Isom. Is that correct? Isom, thank you. Director of Policy and Advocacy. She oversees government and community relations, grassroots advocacy, policy research, and other relevant studies designed to decrease child hunger and family food insecurity. Beverly and her team utilize evidence-based best practices in accordance with the Independence Review protocols to ensure the Policy and Advocacy Department delivers on its goals. Please join me in welcoming both Jocelyn and Beverly this evening. And for any questions, if you could hold that till after the speakers have finished. Thank you.
Thank you all so much. Hello, everybody, and hello, everyone joining us virtually. We're really glad to be here. Thank you so much for your interest in this topic. We, of course, are very passionate about it and really just grateful to have the chance to talk to you about it.
Yeah, we'll have to share the screen.
Okay, so go ahead.
So it's there.
Mhm.
Trina.
Oh, I need to go and share the.
Yeah. And there's a mouse there. I do. I make copies of it. Thanks.
And give us a second. There we go. All right, hopefully that'll, yep, there it goes. Okay, so everybody can see our presentation. So I just want to start off by kind of, really establishing first who knows or feels they know the difference between hunger and food insecurity. I mean, is it at all vague to anybody if you to admit it at all, or it was very vague to me before I started working at Operation Food Search. But I think it's important to talk about the difference because we do use the terms interchangeably, but we've had some great questions even tonight before we started about the difference between hunger and starvation and food insecurity. And what we like to talk about is that hunger is the physical state and the physical sensation, and food insecurity is the circumstance of not having access to enough nutritious food. So we serve people who have all different levels of food insecurity. They could be marginally food insecure, or they could be going to bed hungry. So there's a wide range, and all of those exist here in our neighborhoods and in our state. So just wanted to set that for starters. Love to tell you just a little bit about Operation Food Search before I turn it over to Beverly to talk about policy. Let's see. Every computer's different. So Operation Food Search, we consider ourselves a hunger relief organization. Our origin is as a food bank. We started even before our incorporation 41 years ago. We started when a former priest named Henry Lessing decided to approach Roger Dearberg. And he said, "What are you doing with all your leftover produce?" And Roger Dearberg said, "Well, I give it to the farmers to give to the animals." And Henry Lessing said, "What about we give it to people?" So this was in the late 70s when a lot of food banks were starting, because the government was sort of handing off some of these services to nonprofits and charities to try and fill the gaps. So a lot of food banks started to come into being around then. 41 years later, we're still here. We shouldn't be here. We should not have a job. We do though, and the need is still great. But what we do to try and remedy that is we work on both the short-term immediate hunger relief, getting food to people every day because they need to eat every day. And we work on the long-term solutions to try and sort of end this cycle so that, organizations like ours don't have to exist. So that's where Beverly and her team come in to work on those long-term systemic solutions. So we serve about 200,000 people every month, and that's through a lot of partnerships. We rely on our partners that are pantries. We rescue food from the big grocery stores. We get it into our warehouse. We're kind of like the mothership that rescues and sorts and stores and refrigerates and even purchases food. And then we get it out to all the little partners, the little pantries. We get the child meals to the libraries for after school meals. We rely on hundreds of partners. So it's wonderful work because we're collaborating all the time. But it's a big operation that requires a lot of moving pieces. We serve the bi-state area. So we're in 42 counties in both states. Some of the areas here where you see the 15 additional counties, we send nutrition education resources and programming there. We don't actually distribute food. So our sort of impact in these areas varies quite a bit. Some of the ones that are closer to us, we are sending food every day, and we're interacting with a lot. And some of the far-reaching areas are nutrition support. So our mission is to heal hunger. So we use innovative and collaborative solutions that provide food today and help create a hunger-free tomorrow. And that is the sort of dual approach that I've been talking about, like going down parallel paths at the same time. And our vision is, of course, a region where everyone has the food they need to live a healthy life. We are really sort of working on our core values as an organization. They're listed here, but the reason I bring it up is because we're expanding in our facility. We're building out new office space and also rooms kind of like this one, so that we can help smaller organizations with some of their space needs if they need to have an event or a teaching or some kind of gathering, that we could share our resources with them. So we're trying to be more mindful of empowering all our partners that help us do our work. And one thing we have is space. Our strategic plan is behind all this. It's behind our growth in our programs and the development of our building into a more versatile facility. It was sort of originated to be a food bank. And now that we're working on long-term solutions, we have to have client-facing programs. We have to have more kitchen space. We have to have more refrigeration to keep fresh produce so that we can really provide healthy food. So all of that is being taken into consideration. So our work is divided into 3 pillars. As I've mentioned, meet the immediate need, build nutrition IQ, and champion change. So meet the immediate need is the food banking, which we called agency distribution. That's a picture of our warehouse where we get a lot of the food in and we sort it and then we get it out to our smaller agency partners. We also have a newer program called St. Louis Metro Market that you might have heard of. This was an existing nonprofit, but they worked out of our warehouse and we acquired them this past year, and we could not be more thrilled. It's allowed us to go into areas with low access and provide a lot of fresh, healthy food. It's a converted city bus that is just like a farmer's market on wheels and sort of brings a lot of energy and joy. There's a lot of positive sort of, experiences there. One thing I'll note is that people shop on the bus and it is a paid model. So that's different from anything else we do where we give out food for free. And a lot of food banks are looking at those paid models as a way to empower people because it gives them more agency and choice. So it's a balance because not everybody can afford it, but we have donors and sponsors and corporate partners that help us to keep the food prices very low. So that's the idea, is to try and give people sort of the power to shop for themselves. And then our child nutrition programs, we do USDA regulated programs for summer meals, after school meals. Basically, anytime kids don't have access to school meals that they rely on, we try to fill those gaps. And we get out, food that's nutritionally sort of balanced for kids, and libraries and all our other partners are the ones who help us distribute the food. So that's a really important part of our work and a big focus. This shows you a little bit about the way the food comes in. We rescue it. We get it from food drives. If you guys do food drives, it's brought into our facility and sorted, like I said, grocery partners. And we do produce rescue from farms. So we go out with volunteers and do gleaning out in the fields and get the crops that the farmers aren't going to be using, and we distribute them to the people in our community. So it all goes through us and then to the pantries, shelters, and other food sites to the community. talked about food access with Metro Market, and really excited. We have some new partnerships. Tomorrow we do our first stop at the International Institute. So it's been a very interesting process of figuring out what is sort of culturally appropriate, what kinds of things people want to shop for. It's going to be a work in progress. That food, as you know, is very personal. And so we really try to be mindful of keeping it, just being respectful of where everybody is coming from as much as we can. Build Nutrition IQ is really how we help people understand the connection between their food and their health. And a lot of it is about helping people shop on a budget. It's really overwhelming, especially if you can't afford. I mean, the food prices are so high right now. If people can't afford eggs, how do they make something for their family that maybe has an egg substitute? So we've got nutritionists who go out in the community and do demonstrations and provide samples. It's also very helpful because we may rescue food that people don't know how to cook. So we may get in, some kind of eggplant that they've never cooked with, and we want to encourage that food not to go to waste and for people to use it. So how do we make it easy for them to take it and use it at home? And champion change, I'm only going to touch on this in one area because this is Beverly's expertise, but this is basically all the long-term and systemic work we do. And the one aspect that I will cover is this idea of innovation. We really feel like innovation is a part of all that we do, but where it comes into play in our work is this food as medicine area. So basically a lot of hunger relief organizations now are working on food as medicine. And what we're doing is we're getting food and services to people with certain health conditions. It could be pregnant women, it could be people with hypertension or diabetes. And we're tracking the data through the help of the Social Policy Institute at Washington University to make the case that food should be a reimbursable healthcare expense, just like medicine for certain conditions. So a doctor could prescribe food for somebody if they know that it's going to impact their health to that degree. We have done a pilot with pregnant women, and we found that we improved the preterm birth rate considerably. Was very encouraging. As you all probably know, we have, really atrocious birth outcomes in the city, and it's not only the right thing to do, but it costs $65,000 every time a child is in the NICU. So these are incredible cost savings, and we're trying to make that case to insurance companies and to lawmakers. So that's an overview of our organization and our work. And I know because you all are so, focused on how to help through advocacy, I'm really excited that you're going to be able to hear from Beverly. She's got incredible experience, and she's going to tell you all about what's been going on in the legislative session and the other stuff we're working on.
Here.
Spacebar.
Okay, thank you. Hello. My job is to talk about policy, but not talk about statistics, and in a much more narrative way to help people understand. And policy is the work we get to bills. Advocacy is us trying to tell the legislator and other elected officials in the community about those bills and why they're important. And so one of the things that I read when you guys promoted this event was about the discriminatory practices that sort of created hunger in the first place. So that was interesting to me because the equity component of our work is critical. So I have to say that for me, this is not an academic exercise. I am closely aligned with food justice because I was a child of poverty. And there are days, just like people who are in the Depression, I still look at the world through that lens. And so Black people, and I will reference that because the food systems that are the result of structural racism is a reality. And so all of these marginalized communities and quote unquote promise zones and neighborhoods that don't have grocery stores is a systemic and designed plan, unfortunately. Following the Civil War, former slaves, and I will tell you that I have done more than enough DNA on my own family and Ancestry.com on my family to know that there is a point where on the census that it just literally says boy 9, no name. And so I have had the fortune of living in a poverty environment with my mother, my grandmother, and my great-grandmother. So I knew my great-grandmother, who was the transition from slave to sharecroppers. That was the life she led. I wish I could say that knowing all of that history made me someone who was much more conscious about food. It did not. The policy decisions for 4 million Black people who were left without land based on the promise of land and then having to move. This migration north was intentional and an escape for people to find better lives. There are still some of the work we'll talk about, Black sharecroppers who were overcharged, and just your relationship with food and medicine and where you live. Someone asked me earlier about the Fields grocery store, and Monica Jocelyn could talk about it as well, is that it was Beyond Housing that realized that we're doing all this housing work. Oh, we also need to think about the other cycle of things that people who are building homes and people who need homes also need. Those are healthcare, that's grocery stores, that's education. And so for us, policy is just one of the ways by which we're trying to, it's really more about education than anything else. And so I can't hit on everything, but I will hit on the things that we've been working with as it relates to the legislature and as it relates to advocacy, which we never do alone. It is a coalition from voting to food to federal programs around WIC. This is not work we can do alone, and we invite all of you to join us as we do it. So low food access is a serious problem in St. Louis. And I know we talk about immediate need, but it's also this access. If you drive around North St. Louis or North St. Louis County, you're likely to find 5 Family Dollar and dollar stores before you find a supermarket. That's the reality of what it looks like. 56% of the residents in the city of St. Louis, where I live, are low income and have food access issues. 27% of the residents across St. Louis Metro are low income and have food access with less than a half mile. Think about how often you can run to the store, get in a car, and get to the grocery store to get what you need. Oddly enough, the areas where the median household is between 60,000 and 140,000 have the greatest amount of grocery stores. So just wrap your head around that a little bit. The people who need them don't have them, and so think about that. That is the origin back to this sort of systemic change in how planning and how institutional racism can create these kinds of barriers. So areas with medium incomes around 30,000 have the least amount of Aldi and Snook stores. The proposed legislation that we've been working on with Senator Doug Beck is a bill that would increase the tax credits for food pantries, tax credits for grocery stores that are done in areas where there are food deserts and there are no grocery stores, and in areas where, which is new and part of the innovation, is small scale farms and getting people like Jocelyn addressed to grow the food and then us put it on things like the bus or provide that to small grocers or independent grocers. The legislature's last day is tomorrow. So everything I talk about could be changed in 10 seconds, just so we're clear. But I am incredibly hopeful because I know what's on the other end. I know that the people who really need this are hopeful at no matter what incremental steps we make. This is the federal programs that Jocelyn referenced, the USDA programs around SNAP benefits, and some of the sort of systemic ways and stigma attached to people who get food vouchers and EBT cards from the federal government. So part of that is let's restrict their work requirements that would limit their food assistance. So if they work and they make this much, then we're going to reduce their food benefits. There are numerous studies that confirm that, putting restrictive work requirements don't improve earnings. It just makes them more food insecure and unemployed. It doesn't flip. Currently, the income received from the training programs, if you can imagine that, these are training programs for SNAP recipients, that it's used to penalize them for getting jobs and increasing the amount of work that they did. So one of the, again, legislative ways by which we're looking at that is to make sure that that gap or imposing requirements that would not allow you to be penalized for working. And we understand, like I said, I am hopeful wherever steps we make, the immediate loss of government benefits and food stamps and access to food should not be the penalty you pay for trying to be trained. You're not even got the job, just being trained to get the job. So the Missouri legislature has made several tweaks to the House bill. We'll see what it looks like when it ends up tomorrow. But again, if not this legislature, then I'm always hopeful that they're going to be working on food justice for some time. Many foundations and donors are also doing this work, so we're not alone. I will tell you that the Missouri Foundation for Health made an announcement in January where they're going to spend the next 20 years focusing on food justice. So they understand the importance of the policy that has to accompany not just the immediate need, but the sort of long-term decisions that we have to make. And I put this chart here because sometimes we always talk about 185% below the poverty level, and no one knows what that number is. And so we're trying to talk more openly and more transparently about what that means. How, this is the allotment for a month, is that for people, the maximum is $939. And I was telling someone earlier is that I can spend $281 in the grocery store just by mistake. And they have restrictions on what they can buy. If you've ever been in some of these stores, and we're talking about these in more than just what they can buy and what they cannot get, but also the stigma associated with people who have EBT cards. And I'm going to show you an innovation work that we're doing later on. But if you've been in stores where it's these two aisles, or tag the food and making it easier. So we're trying to get around the dignity of people who have to, for whatever reasons, have to be clients and have to have EBT cards. So there is some dignity attached to being poor, and we're trying to work through that language and helping people to understand that. This was done. The Missouri Senate recently voted to extend postpartum Medicaid coverage from 60 days, and I think that's to after the child's, to 1 year. The bill is going to his desk for signature. He has agreed to do it. The extension would cover more than 4,000 people who otherwise would go uninsured 2 months after. And Jocelyn talked about our work around women and children. Is far more known around what Operation Food Search does for women and children because of our WIC work and because of this kind of work around postmortem and maternal mortality. 32 states and Washington have already done this extension. I don't care if we're the 39th or the 40th, just as long as we do it. The universal school lunches is another one of the efforts that we're working with Jeff City on. I think most of us would agree that kids deserve 3 meals a day, whether they're in school or whether it's summer. And so this legislation is about expanding this so that we don't have yet $56 million to expand pre-K to all 4-year-olds who are eligible for free or reduced lunch. The version of the budget funded the pre-K despite concerns from some lawmakers that it would be too costly. We still believe that food justice and hunger are nonpartisan issues. And so as much as we can talk about whether or not it is enough or whether or not it's too much, the funding is set up in a separate line by the Senate, and it has made the final version so that we shall see it's a $50 billion budget. I think they can inch out a little more than 56 million to help us expand the program that would feed kids. The child care benefits is a big deal because this is something that Missouri has done a lot of education in the news about. Part of the governor came to St. Louis specifically to talk about these tax credits so that people who wanted to work would not have to worry about daycare for their kids. So some of these childcare benefits are in the vein of helping employers to provide tax credit and helping parents to have some place for their kids to go so that they can go to work. A safe place to go. Here's the innovation part of some of the work that Jocelyn referenced. So last year, Operation Food Search started a project in coordination with the WIC state agency and with some researchers at WashU, because what we found out was we did some research around what are the barriers. Only 52% or somewhere, 52% of the people were satisfied with the work that they got when they went into a supermarket and they were a WIC client. We still know that there's still 47% of people who are eligible for WIC in Missouri who don't have it. So part of our work is to help people understand the value of it so they can enroll. And the work that we did, we found that some of the people who are already WIC clients were complaining or identifying barriers when they got into the store. You know, the cash register, maybe there was an issue and the clerk didn't know how to put it coded. The person didn't know whether or not their items were approved or not approved. So we did the research to identify those barriers in the first part of what we did.
And Beverly, tell everyone what WIC stands for.
Oh yeah, I'm sorry. And it's the Women and Children, infants, women, infants, and children. And that project alone supplies funding for women who have children, women who are pregnant. Yes, thank you for reminding me that we talk in code all the time. So the research shows that the training for store managers and staff would be one of the ways by which we could improve the experience for those women. And now we're in phase 2 of that project. So we're still working on it. We are working on it with the WIC state agency and with WashU. We just started to identify some of the ways by which we can help. In-person technical training. What you're looking at on the screen is this WIC Shopper. It's an app for people who are WIC recipients so that they can look on their phone. They can go and they can see which foods are eligible and not. There's a lot more they can do on there. There are FAQs, there are information, there's nutrition information. And so what we're trying to do is help use this and educate clients as well as grocery store clerks and managers. So we have 2 different levels of this. We're using videos. So we're creating the videos in coordination with WIC and with the researchers who are going to help us identify whether or not the videos and the training that we've done has been proven to be helpful. Some of these are going to be seen in health centers and not just, you know, at home or on linked alone. So they will be in places where WIC clients are so that they can see this. The training that is done in grocery stores will be done over and over again because the turnover in the grocery store, if you were here last week and you don't work here anymore. And so the intent is to use the videos to be much more educational and much more conversational to help people understand, and also to decrease the stigma around clerks who are having issues. Oh my God, here she comes with the WICs. Oh my God. And so we're trying to do some of that work as well, and adding the humanity back in the work that has to be done around people understanding what poverty looks like. And as a child of poverty, I think I make it really clear, no matter what I do today, like I said, I still can put myself in the shoes of people who have to do this. So we're creating this mini series of videos, FAQs, QR codes so that people can make it easier to understand. And that's where we are now. We're doing scripts, we're doing the videos, and then we'll assess whether or not and how effective those things were. That's just one of them. The other ways by which we're doing sort of food justice work is trying to find ways by which there are urban farms in Missouri, because some of the legislation address, again, tax credit for urban farms. But we are trying to make sure that we understand the process from city to county. Are the permits required for this? There are neighborhoods in the Ville and North St. Louis that have had urban farms for a while. And we're trying to take some of the food that they have and put it on the mobile market. What I can also tell you is that there are partners who are helping the mobile market identify for, hypothetically, I think the healthcare centers who are we have stops for senior citizen homes in North St. Louis. That's Homer G. Phillips, I think, the senior citizen facility. The healthcare has a relationship with identifying this particular audience because they understand that there's a high percentage of hypertension, there's a lot of diabetes, there's a lot of heart disease. So it's a natural relationship for health centers to be engaged in sponsoring stops at those kinds of locations. And there's another nutrition component to that. We're teaching people how to cook differently or a little bit more healthier. If you traditionally and culturally have cooked greens that have pork in it, we're trying to take the pork out, trying to take different kinds of ways by which you can remain culturally appropriate and eat the food you're familiar with, but just do it a little bit healthier. And so the mobile market is one of those innovative ways. Another way, like we discussed, is the urban farms, but also rural places. We are looking at, are there rural places that we have not gone to take that kind of food and put it on a bus and let people know that it's locally farmed, produced by this particular farm. We're having relationships and food systems with Black farmers who are in St. Louis, who some people didn't even know existed, but trying to figure out ways, like Jocelyn addressed, the training rooms and space around educating people around the relationships and how can we do the food systems better where we live. And there is a lot of opportunity to do that. And so that is the, sort of the beginning of the innovation work. And it is not just there, but we're looking at nationally how other people are doing this work as well and seeing if there are ways that we can also mimic their efforts. That's what I have so far. I'm going to give it back to Jocelyn. I know we have some part of this where we'll take your questions and we're eager to do that, but we'll do the good cop, bad cop right now.
Yeah,
You be the good cop.
No, thank you so much, Beverly. That is amazing. I think that's, basically we just want to, if there's anything that you guys take away from tonight, it's really just thinking more broadly about the food system. It is very complicated, but our hope is that we can create a hunger-informed community, and it's really wonderful to have the opportunity to speak to you guys about it, because I think food is something that touches all of us, obviously, but it's a real entry point. It's a way to connect with people, and it's a way to sometimes give them a warm handoff to other services. So it's really important, I think, the way it's intersectional and we collaborate with other organizations. So as much as you guys can be aware and plug in where you're interested in it, I think it's going to be very helpful to us. So the continuing struggle is just that, after COVID, I mean, there was, a lot of need that I'm sure everybody saw, and we all saw, how many people needed help that had never had to seek out services before. So that awareness is definitely helping people to understand a little bit better and see past the stigma. But unfortunately, now we have inflation and we have rising food prices, and a lot of the families we serve are still really struggling, and it's not been as easy to bounce back as one might think now that the pandemic is, largely past us. So we are continuing to do our work. We encourage everyone to follow us on social media and look on our website. We've got a lot of great resources, a lot of wonderful volunteer opportunities, whether it's coming into the office to, write some thank you cards or going out into the field to harvest apples. So a lot of great stuff there. And we just welcome your questions. I know we've thrown a lot out at you, so.
Thank you so very, very much. Hope you, we've reserved some time for speakers to answer your question. Yeah. If you have a question, you can come to the microphone that is.
You moved it right here.
Oh, I wonder if it's right there. Okay. And for a quick reminder, many of us have our own ideas on today's topic.
So please share your information with a question attached to it, so.
Now,
I'm gonna leave your name and-
What's the difference between SNAP and WIC?
So SNAP, thank you. That's a great question. All the acronyms are really hard to keep track of. So SNAP is really more broadly for everyone who is food insecure and who qualifies for benefits. WIC is specifically for women, infants, and children under age 5.
Okay.
So they're both federal supplemental nutrition programs, but they have different focuses.
So
Snap,
I'm a single mom, I go on WIC.
Yeah, if you are elderly, if you are disabled, if you have some permanent condition that does not allow you to work, you are understaffed.
Okay,
So elderly, disabled, or sometimes
so are they
understaffed.
the same issues in terms of
Mhm.
grocery
Yes.
stores? No,
Yes.
what's available for,
Yes.
Although,
the-
thank you for asking about that one, because part of the issue that we're discussing legislatively is how we get them the ability, how they get the ability to use those EBT cards if you're disabled or you're elderly and you want a hot meal. They can't Grubhub, they can't just call up and have somebody deliver, and we're trying, because they have an EBT card. And what we're arguing is that it doesn't matter what kind of card they have, they should have access to hot food if that is what they are choosing to do and they're disabled or they're elderly. And so that is part of, you're absolutely correct. I should have been a lot clearer about that in the beginning, the acronyms.
You're fine, yeah, thank you for clarifying. Want to go ahead?
the microphone in front of my.
So I was gonna ask you a question. I don't know if you were attending the summit about this issue. It was over 300,000 of us with more than 150 countries. Were you there as part of that?
Someone on our staff, the FRAC conference,
Yeah, the Food Revolution.
Yes.
Network. Yes, it's
Yes.
fantastic. So I was gonna, do you know?
we have someone who was there before, it was last year, and then there was just one last week that
Yes,
the government had that, I remember our staff was there.
yeah, it was free. It was free.
Oh, no, this is the difference.
Okay, no, the one I had was free. It was over 130, I mean, after the first session, 242,000 people liked it. So it was talking about, for example, lifestyle medicine,
Yes,
which means, of course, you're eating for optimum health, healthy weight, stress management, social connections, adequate sleep, and then focusing, trying to get the medical schools now to prioritize prevention and nutrition as the first goal. I mean, they're looking at the big picture and making changes. So,
we please share that link if you have it.
Yeah.
Yes, I'm more than happy to look at
yeah, I think now you have to pay for it, but
it.
what's going on?
We'll take it.
Yeah, but it was like $97 for the 8 sessions, which were each 2 hours late. If you want the 45 experts hour-long session, you have to pay more, but we're
Okay.
talking now about, 40 hours and the best of the best.
All the research helps us.
Yeah, so one of the questions, one of the studies showed that people's household, if families have household income of 100,000 or more, only 1% of them ever would watch TV more than 5 hours a day. But people that are low income, 30% of those households watch TV 5 hours a day. So the food industry is targeting through TV to maximize buying unhealthy products. Can you
Yes.
address that? And if you're looking at these.
And I think that that's just what Carlton will go, that's just the economics of the world we live in. There was a point during the 70s where cereal was being targeted every Saturday morning and
Yeah.
children never bought cereal. So it's the same kind of rationale around that kind of marketing of food as opposed to marketing health. And so we're addressing it as best we could, but we live in a place that sells food. Unfortunately, we'd like to have less chips and soda
Right.
at the place you can walk around the corner to. And so that is that much larger policy issue that we're trying to confront, and getting people to make a shift that's cultural as well as educational. So
But the good news about that is that the power is in the consumer's hands. So as advocates and as consumers, we can start to demand certain things from these companies. I mean, it's a little different from the government. These
Right.
companies actually do kind of need to listen to the customers. So it's slow, but I think there can be some progress made if we're demanding that responsibility on their part.
Yeah, and they now have over 10,000 physicians in this country using this approach of prevention, nutrition, and trying to get it switched even to the medical schools. But I mean, they're doing the big picture and they did some small stuff. But I
That's
don't wanna take
amazing.
up all-
I know
Thank you.
Thank
Thank
you.
you so much.
Karen?
Hi, I'd like to, looking at your little chart. A family of two, how much money do they get a month?
I have to go back and look at the
Okay,
chart.
I thought it
It's
was like
what-
only five.
The 200 was one person, so it had to maybe,
281.
I'm sorry, the 581?
There's
Oh.
21 for one, 532 for two.
Okay.
I don't know.
What can we as an organization do specifically to help you? We can all sit here and say, thank God it's not us. We want to help. Specifically, what can we do to assist you?
there are a lot of ways. You talking about the immediate need for the advocacy. That is the sort of, when we're asking people to write a letter, when we're asking you, and you don't even have to leave your home in some of the cases on the advocacy efforts. It's being connected to our website so that you get the information when we're trying to push one of these bills to go through, even though we're at the day before the last day now, but there'll be another session. So
Oh,
we can
yes.
always use,
Yeah,
we can always arrange.
Tomorrow ends,
Yeah,
yes.
but helping us on the advocacy end and helping us to amplify it in the community where you live and to do it through the work that you all are doing every month and every day. So that's where we're trying to hit the sort of all of the community spaces that we don't even know. But that the eagerness for people like you to help us. And so being connected to OFS's website is one way to get the news as quickly as you can, but.
And I think the advocacy is, I mean, most of the time I go out and I say, oh, volunteer or donate. But for this group, I specifically think the advocacy would be helpful because our advocacy work is only about 4 or 5 years old. We are building our network. And we can really use the help, like Beverly said. I mean, there will be phone calls and letters, and it's important to have engaged people who take an interest in these things and have sort of the lens that you guys do. And I think that's really how we could benefit the most. So we'd love to keep you guys informed
And do
about
you
that.
ever team up with other organizations, let's say for a lobby day?
Oh, yeah, we just had one last month with Greater St. Louis Inc. So there are about 20 of us who were on the bus who went to Jeff City that day.
Okay, so we need to connect with you when you're gonna be
Exactly.
doing these things.
Absolutely.
because It's great to hear the stories, but we have to have the boots on the ground.
That's what we
and
need.
to change.
That's
so-
what we need.
Okay, thank you.
Thank you.
Love that.
A person online said, she had questions about access food when you don't have transportation to get to it, even when it's free.
Yes,
Is there work being done? Are there solutions?
yes.
Okay.
Yeah, the short answer is yes. The long answer is because everything costs. So just like you get a food voucher, we're trying to get transportation vouchers as well. Some of those people have to go farther than 2 miles to get to that grocery store. And so we're trying to make the case that there's a food desert. There's also a need for transportation in food deserts. And so we're trying to make that case as well, understanding that there may be other ways by which this innovation happens. Places like Instacart, the way that you can Grubhub. So and Walmart and everybody else who actually you can order the food and get it to you. So we're thinking in between those spaces around transportation and how we deal with it differently in the new environment that we're in.
Yeah, there are a lot of possibilities that everybody is sort of piloting to see if those more innovative, like, programs can work for this. But that's a huge thing to solve. I mean, as Beverly talked about, I mean, the food, what we call food deserts, which is really food apartheid, because people have been intentionally kept out of, accessing the food that they need. It's, an old problem and it's going to take a while, but there are some new technologies that are helping. So.
Great, thank you.
Thank you. And I'd like to ask you a question just out of curiosity. I don't have children that are in school now, but I see where a lot of the programs for subsidized food are running into some real significant stigmas for the children that are receiving aid and those that are not. Is there a model anywhere that has has reduced or eliminated or that type of stigma for people that receive the lunches?
Absolutely.
That is such a great question, and we have been working on solutions. We have a Missouri School Breakfast Program that we have been piloting, and a lot of that. So with breakfast, if it's somebody who gets free and reduced meals at lunch, you can't as easily tell the difference between who those students are. But the only people who are going to breakfast are the ones who get free and reduced price meals. So there's more stigma at breakfast. There's often trouble with transportation, getting there on time. So a lot of students who really need the food are not accessing breakfast. So we've developed ways to have grab and go carts that people can, just take sort of ready to eat breakfast sandwiches. And in the younger elementary schools, having breakfast in the classroom has been really effective. Some people feel that, oh, it's going to be disruptive to teaching, but the teachers love it. It's sort of this community, you're going to have a little bowl of cereal. And even if a kid has already eaten, kids need a lot of fuel. They need to be able to focus. It's shown to be very popular with teachers to reduce trips to the nurse, complaints about not feeling well, which is being hungry, and also behavior issues. So there's a lot of arguments to be made, and there's ways to get creative about it. Did I miss anything?
Oh, no. I think the same issues that kids have are the same issues that adults have. So if you have food insecurity as an adult, then the impact is the same for kids. Right. And so that's just, before this kind of innovative work, a kid would be, if their parents didn't pay, they didn't get fed. And so we're eliminating some of that kind of stigma out of the way and simply saying, we think everybody thinks that most of us, no matter what party you believe in, believe that kids should have 3 meals a day, especially if they are in school.
Yeah. Thank you very much. You have a question?
I'm not sure exactly what questions I have. So I have a child with celiac. So do you, in donations and stuff, is that a challenge that you have meeting that need for people that have a need for specific dietary restrictions? And then my other question is, legislatively, when you talked about trying to get insurance to cover food as a prescription, is that part of the would that be covered under that, because the cost of gluten-free food is ridiculous. So even for those of us who, I can afford it, but it makes a big difference in how much money I'm spending on food for my kid who has that restriction.
Right. And what I didn't mention, and I should have, is the farm bill that is trying to be reauthorized has about 80% of the farm bill deals with nutrition. Some of that deals with the kind of questions that you just asked around sort of the much more specialized food and the way that the government can supplement people getting it. A, because it's expensive. B, is because it's not thought of if you don't identify that particular audience of people who are gluten-free. There are poor kids who are lactose intolerant. Exactly. Right. And so kids who can't drink milk, and is it okay for us to have other kinds of milk other than? So the farm bill is something that coalitions in Missouri are dealing with and understand the value of it, because so much of that bill has to do with the work that we're doing every day. I think you're going to address that.
Just that there's a long way to go, but it is being talked about and how important it is to get people the nutrition they need.
Do you get sufficient donations though, to meet the needs of your clients that have gluten-free needs?
Frankly, we don't track. We're not able to track yet. We actually are improving our inventory system. So we have a new nutrition policy that prioritizes certain kinds of food, and we will be able to track those types of things, but we haven't been able to do that really until now, and it's new.
I guess I just don't understand how that works. If people come in needing food, do they have choices? Do they come in and
they have
select?
They have the choices, as many choices as possible, but often that's very limited. So, there's a real effort to give people choice, but sometimes that's just not the food that was donated.
Yeah.
So
I'm asking a question from one of our online watchers, and it is, they saw in Chicago people stocking food deserts with refrigerators. And is that something you guys are familiar with? And could you speak about that if possible?
Well, I've seen that, there is a lot of innovative work being done. And I have seen that that is being done in other cities. And there are some towns, like you'll find one-offs, but that is not something we have done yet. I mean, we're sort of, as part of our strategic plan, we're thinking very seriously about where we're going to invest our efforts because, we can't do everything. So part of that process is surveying the community. We're sending out a very broad survey right now to the people we serve and doing focus groups because historically nonprofits and charities have been very sort of, patriarchal and we've decided what people need, but we don't want to do that. We want people to tell us what they need. And we have to, seek out their opinions and their experiences. So we don't know yet if we're going to do that more of that type of, neighborhood refrigerator or the, the food delivery models, the medically tailored meals. There's a lot of options and a lot of great innovation. And so we're trying to figure out right now where to put our energy.
And I will tell you that today, my mother who has diabetes, she has heart conditions. So she told me she was getting a packaged meal today. This is the first time ever I've seen this. And it was done through Medicare. And I was surprised to see what was in there. And these are all, prepackaged, really healthy stuff, bread that she wasn't accustomed to eating. But the point is that was not something she asked for. It was something based on the design of her healthcare plan and them calling her, taking the initiative to say, hey, we have this available to you. Do you want it? She's never done it before. She's been on Medicare for a long time. She's had a heart condition for a long time. So there is this movement beyond just nonprofits and foundations and healthcare centers. Even hospitals and healthcare organizations are trying to figure out how do they address this food insecurity issue themselves. And that's one way. Look, that transportation, my mother didn't have to go anywhere. It was delivered to her. And so there are all these different kinds of new ways that we are trying to address a much huger problem, as she mentioned, a global problem that we're trying to address a state at a time. And it could be better, but right now I am happy with any progress we see.
That goes with our next online question. Do you work with seniors directly?
Yes, we do. Some of our partners are, we partner at senior centers. We have some agencies, some pantries that specifically work with those populations. And as Beverly mentioned, our metro market is going to be going to the Homer G. Phillips Center. So we do, yes, but we've talked a lot about doing more of that work. So, as we expand and increase our programming, that's going to be something we consider.
And keeping the data on that is something that we are taking a lot more effort to do, not just say, hey, we went to this particular senior center, but we also want to know how many seniors did we serve and how many days of the week. And even if it's not just there, one of the other places it's making a stop is Jennings and Moline Acres. And so we want to collect this data because there is this huge interest. And Missouri is among many other states with baby boomers like myself. There's this growing elderly population that is becoming, and it's not just poor, it's just the elderly who want to take care of themselves a little better. They want to eat better. They still want to run and take care of that bad knee. But so we're looking at ways by which we can collect the data and not just be happy that we're delivering a service anymore.
I'm curious, do all the grocery stores or most of the grocery stores in the area contribute food? Do you have enough food? Would it help if we thanked our grocers for being involved with that?
I think they would love that.
And also, did you say that Fields has a place at Housing Beyond Housing now? Have they opened a place there?
Yes.
They have.
It's Page or Olive. I came back, guys, 4.5 years ago, so I can't remember Page and Olive. But
Okay.
Beyond Housing has a development, and then right across their parking lot is a
Right.
Field store.
Okay.
And that was initiated because of
Yeah,
Beyond.
and they had another store that closed.
Right.
Fields is gone. That's great news. So do you have enough food?
Well, we are short on food donations right now. We are purchasing as much food as possible to try and make up for the difference, but we can't keep up with that. So we have,
They don't donate them, donate the food?
well, the grocery stores donate the food, but they're donating less. So a lot of the supply chain issues, a lot of, the gas prices, there's so many different things that go into this. Some farmers are planting less. So there's so many, sort of different connected things that go into whether or not they have enough to give us. They are very generous. I mean, our biggest donor is Schnucks. They give us about $15 million in food every year. Deerberg's is second, Straub's. We work with all the grocery stores. I think it's important to, applaud them for that, effort, because otherwise that food would be wasted, and that's a whole other issue. So I think they are working hard to try and, get that food out. They send it to us and we try to, to mobilize it as quickly as possible to get it to people. But the infrastructure is not perfect. Like, we will sometimes get a lot of food on a Friday and there are not that many pantries open on the weekend. And this is food that isn't going to last much longer. So we're really, scrambling to, handle the logistics of it. So there are a lot of ways to still improve it. But food donations, a great way to help is have a food drive. We rely on those a lot. We get about $1 million worth of food every year from food drives. It's incredible, because before I worked at Operation Food Search, I was, sending the food in with my kid to school when they had a food drive, and you just don't realize how much of an impact it really has, but it does.
Good to know. Do you prefer food or money?
Great question. I lean towards the money. Even though it is very helpful to have donated shelf-stable food, especially at a time like this when food donations are down, money, we definitely want to get food out today, but the money, we can sort of put it into different buckets. We can work on long-term solutions as well.
I asked because I volunteer in a food bank and we're being overrun by black beans.
Oh,
really? Yeah.
And that's one of those challenges. Yeah. We gotta get our nutritionists, to come up with more creative recipes so people can cook the black beans in exciting ways.
Okay, so one of the things I do is anytime I go to an event that's catered, then because once it's out there, they have to throw it away. So I'm known in my city to always bring that to the domestic shelter for all the catered events, regardless. And so think of that, and that's
I'm so glad you brought that up. We rescue food from the stadiums. We rescue from Busch Stadium, we rescue from the new city soccer stadium, and we've had some fun. We got to do a packing event with all the players where they packed food, for our child meals. So it's really beneficial to be able to have those relationships. And I know the city stadium, for example, is very intentional about waste. So, it's really great to see businesses coming together like that.
that's great.
And do we have any other programs, or I did take this time to thank both of our speakers for.
Thank you. Thank you all so much, and everyone who joined us online. Really appreciate your time.
Thank you so very much.
Thank
That was
you.
so